will attest to the there have been many changes over the past 50 years. I want to take this opportunity to share with you some of the history and some of what has been going on. For many years, Baptists were doing medical work in Nigeria with hospitals in several parts of the country. In 1954, the Nigerian Baptist Mission issued an invitation for one doctor and one nurse to open medical work in the Gold Coast. At about that same time, the director of leprosy service for Gold Coast, Dr. McKelvin, asking them to participate in leprosy control work in Gold Coast. Dr. Robert Goldie and my father, Dr. George Faile, came to the Gold Coast to attend the 9th annual session of the Gold Coast Baptist Conference and to make a survey of the needs in the country. The conference at that time enthusiastically received the suggestion that medical work be undertaken and responded by contributing 90 pounds toward the work. After talking with government officials and looking around at the situation, it was decided that Nalerigu would be the site for the new hospital. It was chosen partly because it is the home of the paramount chief of Mampurgu, and partly due to the lack of medical care in this area. At that time, the plans were to build a general hospital and a leprosy settlement with farmland. Nalerigu at that time was a small village with only about 185 compounds and a population of 2,500. From 1957 to 1958, while the hospital was being built and residences constructed, the Failes lived in Tamale. During that time, Dr. Faile made regular trips to Nalerigu with a mobile clinic to see patients in the center of town near the chief's palace. In late 1957, Samuel Olawuni, a Nigerian leprosy control worker, arrived and was joined in early 1958 by Adam Mamuni to operate leprosy clinics in the surrounding villages. Some of those clinic buildings are still standing today. Then during the 1960s, all responsibility for leprosy work was taken over by the Ghana government. In March of 1958, the Failes moved to Nalerigu and clinics were held in one of the rooms at the present generator building. Finally, on August the 2nd, 1958, the hospital was officially opened. In attendance at that dedication service, along with local chiefs, other dignitaries, and missionaries of the Ghana Baptist Mission, was the first president of the new Republic of Ghana, Dr. Kwame Nkrumah. The initial buildings consisted of the outpatient department, maternity building, and main ward block. During the second phase of building, an operating theater, private ward block, isolation ward, and staff quarters were added. From the beginning, there were a large number of patients, and during the first 6 months, 20,500 patients were seen, 329 were admitted, 50 operations were done, and 30 babies were delivered. I do not have the figures for the number of staff that were initially employed, but in an article printed by Ghana Information Service in 1964, BMC was called, and I quote, one of the best hospitals in the country. And at that time had a staff of 56 and 64 beds. The first baby born at BMC was Anita Cather, whose parents were missionaries in Tamale. The first Ghanaian baby born at BMC was John Tayari, who is now working at the hospital. He is now working at the hospital as our chief accountant. In 1959, Mr. Sid Fluellen and his family arrived to organize and set up the laboratory. And they soon hired Mr. Musa Basukuma, a qualified lab technician, who continued to work at BMC for many years. In 1960, Dr. Goldie and his family arrived to relieve the Failes when they were on furlough. Mrs. Goldie was a nurse, and she organized the first ward assistance class. Time does not permit me to name all of the people who came and helped to establish the ongoing work at BMC, but I want to mention a few others who began certain areas of work or who worked here for many years. Miss Diana Lay arrived in 1961 and was joined in 1967 by Miss Billie Mae Berry. Miss Lay served as a matron and later taught theater technicians and worked in the operating room. Miss Berry helped to share the responsibility of supervising the nursing department, and during her last years here was in charge of the OPD. Mr. Don Donnelly and his family arrived in 1967 and were here for 7 years as the first full-time administrator. Also in 1967, 2 eye surgeons arrived to teach doctors here how to do cataract extractions. And on June the 20th, 1967, the first corneal transplant in Ghana was done at BMC. In 1968, Dr. Lewis Carlin and his family arrived. Dr. Carlin was a veterinarian and served as a district veterinarian officer during the 3 years he was here. Dr. and Mrs. Walter Moore arrived in 1973. Dr. Moore did some of the initial public health work in the area, even though there was no official public health department at that time. In the fall of 1978, there was a serious measles epidemic, and Dr. Moore helped to organize mass immunization program where over 45,000 children were immunized. In 1974, Dr. Edward Muhammad arrived as the first Ghanaian doctor on staff. He worked here for 3 years before going to the U.S. for further training. In 1975, Mr. and Mrs. Tali Bibb arrived to take over the responsibilities of the chaplaincy department. In 1980, Reverend Paul Musa was hired as assistant chaplain. He later became head chaplain and is still working at BMC today. In 1977, Dr. Bob Anderson and his family arrived to become the first missionary dentist at BMC. In 1978, Mr. and Mrs. Jean Covington arrived to serve as pharmacist, and during that time he also served as field evangelist and later as hospital administrator. In 1978, Dr. Fran Greek arrived, and during the 12 years she was here, began work with evangelism among the Fulani. In 1980, Mrs. Mike Walker arrived to become the first full-time maintenance supervisor. He served in various other capacities during that time, including administrator. In 1981, Miss Judy Hanberrier arrived to begin the public health program. When she left to get married in 1984, Miss Cherry Faile arrived to take over that work and to help develop the program. From the very beginning, the hospital personnel have been concerned not only with physical health, but also with preaching the gospel of Jesus Christ. On Christmas Day 1958, the first 5 converts resulting from the ministry of Nalerigu were baptized in the town reservoir. The church originally met in the town council building. Exactly 1 year after the dedication of the hospital, the cornerstone of Nalerigu Baptist Church was laid by Dr. Baker James Cawthon, Executive Secretary of the Foreign Mission Board, now the International Mission Board. The dedication of the building was held July 10th, 1960. One of my earliest memories as a child here was going with my father to surrounding villages where he went to preach. Dr. Frank Ash, one of the first doctors to come and work at BMC in October of 1958, started work with the Kakombas and had preaching points in some of their villages. It was not only the missionaries who traveled to outlying villages, but hospital staff and Nalerigu Baptist Church members also took an active part in spreading the good news of Jesus Christ. From those early scattered preaching point churches, the Nalerigu Association has grown to over 70 churches, and there are 3 Baptist churches in Nalerigu. This is a brief and very general history of how work here began. We have not been standing still, and we have not been satisfied with maintaining the status quo. First, Nalerigu has grown and changed. As I said earlier, when we first came to Nalerigu, it had a population of about 2,500. And though I don't know the official census figures, I have heard that the present population is between 14 and 15,000. Nalerigu has definitely gone from a small village to a town and is no longer as isolated as it once was. Second, as the population has grown and as the economy has improved, more and more people come to the hospital for care. As a result, staff has increased from a handful to nearly 250. The number and size of the buildings has increased. For example, the pediatric ward has grown from 10 beds to 18 beds to our present 37 beds during the years that I have been here. The numbers of patients that we care for each year has increased dramatically. We have been averaging about 60 to 70,000 outpatients a year, with about 7,000 to 8,000 inpatients. We do 1,100 to 1,200 major operations a year and deliver between 700 and 800 babies. Third, leadership positions in the hospital that were once held by expatriate staff are now being well handled by Ghanaian staff. The matron was initially a missionary nurse, but Mr. Samuel Bajakin has been in that position now for many years. The head of public health, Mrs. Florence Baba, has not only taken over, but has continued to develop and expand the role of that department. The head of chaplaincy, Reverend Paul Musa, the head of lab, Roger Isa, theater in charge, Mr. Zato Inusa, maintenance supervisor, Mr. Kwesi Wuni, all are Ghanaians. And to me, this is a sign of progress. 2 years ago, we hired Mr. John Azabu as our first Ghanaian administrator. Fourth, the public health department has grown and developed into a vital, active department and has improved the health and education of the people, especially in the more remote areas. We rarely, if ever, see measles or polio, which were once common. More and more women are seeking antenatal care, family, and post. The number of VV fistula cases that we see has gone down over the past few years.